The rarest element on Earth could revolutionize cancer treatment. Astatine, the rarest naturally occurring element on Earth, may soon become one of medicine's most powerful cancer-fighting tools. Scientists at Texas A&M University have developed a new way to produce and deliver Astatine-211, AT211, a short-lived radioactive isotope that can destroy cancer cells with extraordinary precision. Despite existing for only a few hours before it decays, AT211 releases just the right kind of radiation to kill tumors while leaving healthy tissue virtually unharmed. This breakthrough could reshape how we treat aggressive cancers, offering a therapy that is both potent and safe. A rare element with remarkable potential. Astatine is so scarce that at any given time, only about 1 teaspoon of it exists in the entire Earth's crust. Its name comes from the Greek word astatos, meaning unstable, because it quickly decays into other elements. Yet this instability may be its greatest advantage. When AT211 breaks down, it emits alpha particles, tiny bundles of 2 protons and 2 neutrons that release bursts of energy over extremely short distances. That limited reach is key. While beta or gamma radiation can harm surrounding tissue, alpha particles from AT211 travel less than a millimeter. They dump their energy almost entirely inside the cancer cell, obliterating the tumor without damaging nearby organs. Targeted alpha therapy can cause enormous damage right where it's needed, inside the tumor, while sparing healthy cells, explains Dr. Sherry J. Yanello, Distinguished Professor of Chemistry and Director of the Texas A&M Cyclotron Institute. The Goldilocks isotope for cancer therapy. AT211 is often called the Goldilocks isotope because its radiation strength and lifespan are just right. Its 7.2-hour half-life is long enough for doctors to prepare and deliver treatments, yet short enough that the radioactivity fades quickly, minimizing long-term side effects. Early studies suggest AT211 is effective against blood cancers, ovarian tumors, and some brain cancers, all notoriously hard to treat. Researchers are even exploring its use in Alzheimer's therapy, where its precision could target disease cells without damaging brain tissue. Since 2023, Texas A&M has been one of only 2 national suppliers of medical-grade astatine through the U.S. Department of Energy's isotope program and the National Isotope Development Center, NIDC. Using the university's K150 cyclotron, the team bombards bismuth with high-energy particles to create AT211, an achievement that only a handful of facilities in the world can match. Turning instability into a therapeutic tool. Producing AT211 is only half the challenge. Because it decays so quickly, scientists must separate and deliver it before most of it disappears. To meet this challenge, the Texas A&M team designed an automated purification and shipping system that extracts AT211 from its bismuth target using a special resin column technique. This patent-pending process rapidly isolates the isotope and prepares it for transport to medical partners, often within hours of production. The faster we can process and ship it, the more useful the isotope becomes for hospitals and research centers, Yanello says. Our method reduces waste and radiation risk while increasing the amount of usable AT211 that reaches patients. So far, Texas A&M has shipped dozens of AT211 batches to institutions such as the MD Anderson Cancer Center and the University of Alabama at Birmingham, where scientists are developing new AT211-based radiopharmaceuticals. Collaborating for a cancer-free future. Dr. Yanello and Dr. Federica Pisaneschi from the University of Texas Health Science Center at Houston are leading international collaborations to expand AT211 research. Together, they will present their latest result at the 2025 World Astatine Community Meeting in New Orleans, the first U.S. conference dedicated entirely to this element's medical potential. Interest is also rising overseas. Teams in Japan, Europe, and across the United States are now studying astatine-based therapies and their possible applications in oncology and neurodegenerative disease. There's global momentum building around AT211, Yanello says. We're just beginning to understand how powerful this isotope could be in the fight against cancer. A new era in nuclear medicine. Supported by the U.S. Department of Energy's Office of Science, Los Alamos National Laboratory, and the Texas A&M Security Office, this pioneering work marks a new era in targeted alpha therapy, a treatment approach that could combine the precision of molecular medicine with the raw power of nuclear physics. For decades, astatine's rarity and instability kept it a scientific curiosity. Now, through advanced production and transport methods, it's becoming a realistic medical resource, one that could help doctors kill cancer cells with surgical precision and minimal side effects. As Yanello puts it, astatine is rare, unstable, and short-lived, but in the right hands, it may be exactly what we need to make cancer treatment more effective